We need a blood supply to the gut, right? And those arteries are going to come off of what? There's only one option, going to the descending aorta. And so if we follow the descending aorta through the chest cavity towards the diaphragm, right here I've shown right where it comes through the diaphragm at the back. It's called the crus, or the crux, or the cross of the diaphragm over there. Spanish speakers, crus, cross, right? Because there's a little muscular cross there. And here's the diaphragm coming right into the gut. And right there is where you get the two main arteries coming off that go to most of the intestines. The one towards the head end is called the first one to come off is called the celiac artery, and the second one to come off is called the superior mesenteric. So what are these? And you know, I know they don't look like much, and there's a lot of stringy stuff around there. So what's happening? That celiac artery comes off and branches to the spleen, the liver, the stomach, and pancreas. Basically all of those organs. The word celiac comes from coelom. Most of the coelomic organs, except for the intestines. Okay, so basically, if guess celiac if it's not intestines, right? If you're looking at an artery, so it's going to the spleen, pancreas, liver, and stomach. Right? And then, coming off immediately caudal, just behind it, is this cranial mesenteric, and you can see it headed out right to that big ball of intestines. So see the artery coming off? It's going behind this little end of the intestines there and going right up into the big ball. And of course it branches and branches. It goes into these cascading loops that, like we talked about in class, go and pick up nutrients from the food that we're digesting. So if you're wondering, why do they have all that stringy stuff around there, I just like to point this out to people. Not only do we need a blood supply to the guts, but we also need a nervous supply, right? We need to get nervous control out to the guts. And of course, is that voluntary conscious or involuntary autonomic?
Autonomic.
Autonomics. And particularly that would be sympathetics and parasympathetics coming from the vagus nerve and from the sympathetic trunk. And there are ganglia. I don't even know if you remember this, but those sympathetic neurons the parasympathetics also have one neuron that then synapses with a second neuron out to the organ, and at the base of these arteries, that's where those synapses come together, and there's a lot of interconnections. And all the stringy stuff are those sympathetic and parasympathetic bundles of neurons that then follow the arteries. They run right with the arteries out to every part of the gut. And in fact, there's even some local processing, which we really don't see anywhere else in the nervous system, right? Pretty much everywhere else in the nervous system, all the processing is happening out in the spinal cord of the brain. We just have straight head, motor and sensory input and output from all the tissues and organs, but not true in the gut. Sometimes they even call this a separate what is it called? Gastroenteric nervous system that's controlling the gut. Yeah, localized control. So if it sometimes feel like your intestines are doing their own thing, they are. And then, if you're wondering, cranial mesenteric does almost the entire small intestines as well as large intestines. There's a tiny caudal mesenteric. If you follow the aorta back all the way up back here, that tiny little artery goes just to the very end of the large intestines. Okay, it's part of the sigmoid colon and rectum. So that in humans. So that's what we have. Those three arteries are, and remarkably conservative among practically all vertebrates, to be honest, going out to the organs of the coelomic cavity. Good enough?
Intriguing.
So you've got your own pigs if you'd like to take a look. I would say most